So if you are to, God forbid, have an acute injury tomorrow, what would be the procedure? What would you do?
The first thing, obviously, is the rice procedure. But I tend to use ice for a shorter period of time.
And the shorter, it means how long?
I prefer an ice cube because it's wet rather than a package or an ice bag. Whenever the ice cube is melted, we immediately put a topical anti-inflammatory on, such as arnica or Traumeel. We give homeopathic Traumeel, and then immediately introduce the laser device, not only to the inflammation, but also to concomitant acupuncture points. So we would go to acuxo.com, the World Home Acupuncture site, and either treat with the head of the laser or treat with the 660 probe for just a few seconds on the acupuncture points. Then we would introduce the Scanar device first in a...
And what about the compression and elevation?
Well, we would save that for after when we were done with the regenerative devices. Introduction of the Scanar device in a brushing fashion, making note of the sticky points on both limbs. Let's say we had an ankle sprain, we would do the opposite leg as well, and then treating, keeping the device still, waiting for it to dose, treating the opposing limb, and then treating the acupuncture points with the Scanar as well. And it's truly miraculous. I need to document these more on film, but a gentleman came in a few weeks ago, a dump truck of gravel had fallen on his foot, and it was the size of a grapefruit, black and blue. He was on crutches. After 3 hours of this methodology, he basically hopped and skipped back to his car. Certainly still had some stiffness and pain, but the color and the swelling were completely gone, and he had full range of motion. So it's really exciting, because what that means is now instead of 6 months of misery, now this gentleman has 2 to 3 months.